Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So, let's get started. Welcome back to Season 2, Episode 17 of Workers Comp Unwrapped with Max. Meet Aisha, who has 15 years of experience in the workers' comp industry.
It's great to be here.
Today we're talking about how virtual hearings, reshaping workers' comp, and exploring tips for preparing for depositions and giving testimony remotely.
This shift to virtual hearings is huge, and I'm excited to break it down for everyone listening.
You've probably already seen this happening in your practice, but did you realize that in some places, virtual hearings have cut case backlogs by nearly 30%?
Oh, wow.
That's a big deal, and today, we'll unpack how this new landscape impacts you.
Absolutely.
Especially when it comes to maximizing revenue by minimizing errors in virtual proceedings.
That's right. It used to be that every hearing was in person, attorneys, claimants, medical experts. Everyone had to physically be in a courtroom.
I remember those days, all that travel time for doctors.
Oh, yeah.
Especially those with packed schedules was a real headache.
Exactly, but the pandemic forced the courts to get creative.
Yeah.
And that's where virtual hearings came in.
And now they're here to stay, even as things go back to normal everywhere else.
Yeah.
What's fascinating is that this switch wasn't just about adapting to a crisis. It actually made the system more efficient.
Absolutely. For doctors, the benefits are clear.
Huge.
Huge time savings, flexible scheduling.
Yeah.
And let's face it, it's probably less stressful than a formal courtroom.
That makes sense. It's like trading in a suit and tie for scrubs.
Yeah.
But I bet there are some downsides too, right?
Definitely technology can be a double-edged sword.
Oh.
Think about technical glitches. A dropped call in the middle of your testimony could be a disaster.
Oh, yeah.
Plus, ensuring HIPAA compliance when discussing medical information remotely is a whole other ball game.
Those are some serious concerns. It seems
Yeah.
like doctors need to be extra prepared for this virtual world.
Exactly, and that's what we're here for. Let's start with the fundamentals. Remember, as an expert witness, your job is to present the medical facts, not to advocate for either side.
So doctors should stick to what they know best, the medical evidence.
Right, you'll likely be asked about the injury if it's work-related treatment plans, and whether the injured person can return to work. Clear, concise answers are key. Think of it like explaining things to a patient, just with a few more legal terms thrown in.
Okay, that makes sense. So how can doctors set themselves up for success in this new virtual world?
It starts with creating a professional virtual environment, and this is where I've seen some doctors make critical and sometimes hilarious mistakes.
Oh, I bet you have some stories. Give us the inside scoop. What kind of blunders are we talking about?
Well, imagine a doctor testifying from a busy coffee shop. I'm talking about people ordering lattes, the espresso machine, hissing the whole works.
Okay.
It was so distracting and completely unprofessional.
Wow, that's a nightmare scenario.
Uh,
I can see why a simple professional setup is so crucial.
Absolutely. You want a quiet, well-lit space with no distractions in the background.
So no kids running around, no barking dogs, and definitely no piles of laundry in view.
Exactly. And make sure you have a rock-solid internet connection. A wired connection is much more reliable than Wi-Fi. Imagine your video freezing or your audio cutting out during your testimony. It could really undermine your credibility.
That makes sense. So we've got the quiet space, the strong internet. What about the background as a virtual beach scene? Okay.
Definitely not keep it neutral and professional. A plain wall or a bookshelf works perfectly.
Okay.
And while we're on the topic of appearances, ditch the pajamas and dress professionally, just like you would for an in-person hearing.
It's all about showing respect for the process, even though it's virtual. So
Yeah.
we've covered the professional setup. But what about the legal and technical side of things?
That's important too. You need to familiarize yourself with the platform being used for the hearing. Is it Zoom, WebEx? Each one has its quirks.
So no last-minute scrambling to figure out how to unmute yourself? What about medical records?
Ah, that's a key point. Policies on submitting records beforehand vary by state. Don't assume anything.
It sounds like doctors need to be detectives and double-check everything.
Exactly. Some states even require pre-hearing tech checks to ensure everything's running smoothly.
It's like a dress rehearsal for the main event. So we've got the stage set now. How do doctors actually testify like a pro in this virtual setting?
That's where we get to the real nitty-gritty, first and foremost. Stick to the facts, avoid speculation, and don't wander outside your area of expertise.
Okay, so no impromptu lectures on philosophy.
Mm-hmm.
I can see how that might derail things a bit.
Exactly. Another important tip: pause before answering. Remember, there might be audio delays.
So those awkward silences you usually try to avoid are actually your friend in this case.
Absolutely, and never ever be afraid to say, I don't know.
Right.
Guessing or speculating can seriously damage your credibility. It's always better to acknowledge a knowledge gap than to provide inaccurate information.
It's like that old saying, it's better to remain silent and be thought a fool than to speak and remove all doubt.
Well, I wouldn't put it quite like that, but you get the idea.
Fair enough. So we've covered a lot of ground, from setting up a professional space to mastering the art of virtual testimony. What else should doctors keep in mind as they navigate this new world?
That's a great question, and a perfect segue into our next segment, where we'll dive deeper into the nuances of virtual depositions and hearings. Stay tuned.
Okay, sounds good.
All right.
We'll be right back.
Welcome back to Workers Comp Unwrapped.
We're diving deep into the world of virtual hearings in workers' comp, a trend that's here to stay and is changing the game for medical professionals like you.
Yeah, it's not just about swapping a courtroom for your computer screen.
Right.
Virtual hearings come with their own set of rules and considerations.
We left off talking about how to deliver killer testimony in a virtual setting. It might feel strange talking to a screen, but practice makes perfect, right?
Absolutely. Practice helps you get comfortable with the technology, refine your answers, and think through potential questions. Consider it a mock trial for your virtual testimony.
Great idea. And I bet being mindful of your body language and eye contact is important too, even though you're on camera.
You're spot on. It's easy to slip into casual habits.
Yeah.
So make sure you're sitting up straight and looking at the camera when you speak.
Right.
It makes a big difference in how you come across.
It's like projecting confidence through the screen.
Yeah.
So let's switch gears for a moment and talk about depositions. I know this can be a bit confusing for some doctors. What are the key differences between a deposition and a hearing that doctors need to be aware of?
That's a great question. A deposition is like a pre-trial fact-finding mission. Attorneys from both sides gather information and testimony from witnesses. It's typically less formal than a hearing and doesn't involve a judge.
So it's more of a behind-the-scenes information gathering session.
Exactly, but don't let the word informal fool you.
Yeah.
Your testimony during a deposition can be used in the actual hearing, so it's crucial to be just as prepared as you would be for a courtroom appearance.
That makes sense. So all those tips about sticking to the facts and avoiding speculation apply here as well.
Absolutely, and just like hearings depositions are increasingly happening virtually, so that professional setup we talked about,
Right.
it's just as important for depositions.
It sounds like the lines between virtual depositions and hearings are becoming increasingly blurred.
That's a sharp observation. The formats and procedures are constantly evolving, so it's crucial for doctors to stay up to date on the specific requirements in their state.
So doctors can't just assume that what worked for one virtual hearing will work for all of them. Speaking of staying updated, what are some of the latest trends and legal developments in the world of virtual workers' comp hearings?
One trend that's really changing the game is the increasing use of artificial intelligence, or AI, in workers' comp.
AI in workers' comp, that sounds futuristic.
It is. AI is being used to automate tasks like reviewing medical records, identifying potential fraud, and even assisting with case management.
So it's like having a virtual assistant for workers' comp cases. But how does this impact doctors on a practical level?
For starters, AI can help streamline the process of submitting medical reports and other documentation. It can also help ensure everything is submitted correctly and on time, which can prevent delays in case processing.
That sounds like a win-win for doctors who are already overwhelmed with paperwork.
Exactly. And with the increasing reliance on virtual platforms, data security and privacy are becoming even more critical, especially when dealing with sensitive medical information.
That's a crucial point. What steps should doctors be taking to ensure they're protecting patient data in this virtual environment?
It boils down to being extra vigilant about cybersecurity. Use secure platforms for virtual hearings and consultations, create strong passwords, and enable two-factor authentication whenever possible. Think of it as adding an extra layer of protection for your patient's information.
Two-factor authentication, just to clarify for our listeners who might not be familiar with that term, is like adding an extra layer of security to your accounts. It usually involves receiving a code on your phone or email that you need to enter in addition to your password.
That's a great explanation, and always stay informed about the latest IPADA regulations and guidelines. They're constantly evolving as technology advances.
It sounds like doctors need to become tech-savvy detectives to keep up with all these changes.
In a way, yes, but remember, you don't have to navigate this alone. There are resources available to help you stay informed, and we'll be sharing some of them in our show notes. Another exciting development is the use of remote medical examinations in workers' comp cases.
Remote medical exams. So instead of physically seeing a doctor, an injured worker, can now be evaluated virtually.
Exactly. It's still in the early stages, but some states are exploring the use of telemedicine for these exams, especially for folks who live in rural areas or have difficulty traveling.
That sounds like a game changer for accessibility. But can a virtual exam truly replace a traditional in-person assessment? I imagine there are limitations to what a doctor can assess remotely.
That's a valid concern. Some medical professionals argue that a virtual exam can't fully replicate the nuances of a physical exam, where you can lay hands on the patient and conduct a thorough assessment.
I can see their point. There's something about that in-person connection that can be difficult to replicate virtually, but I imagine the technology is rapidly evolving.
You're right, the technology is advancing quickly, and proponents of remote exams believe they offer a valuable alternative in certain situations. It's a trend worth watching closely, as it could significantly impact how medical evaluations are conducted in the future.
Absolutely. We've covered a lot of ground today, from the nuances of virtual testimony to the rise of AI and remote medical exams. It seems like the virtual world is transforming every aspect of workers' comp. So what are the key takeaways for doctors who want to not just survive, but thrive in this new landscape?
I'd say the key is to embrace the change, stay informed, and be proactive in adapting your practices. It's not about resisting technology, but rather about using it to improve patient care and streamline legal proceedings.
It's about finding that sweet spot where technology enhances the human element of healthcare, not replaces it. Speaking of the human element, I want to circle back to something we touched on earlier, the potential impact of virtual hearings on the doctor-patient relationship. What are your thoughts on that?
That's a crucial aspect to consider. While virtual technology offers convenience and efficiency, we can't forget that behind every workers' comp case is a real person who is dealing with an injury and navigating a complex system.
It's easy to get caught up in the technical details and forget that we're dealing with people's lives and livelihoods. So how can doctors maintain that sense of empathy and connection with patients, even when those interactions are happening through a screen?
That's where we'll pick up in our final segment after a quick break.
Welcome back to Workers Comp Unwrapped.
We're wrapping up our deep dive into the world of virtual hearings and exploring how doctors can navigate this new terrain while maintaining strong relationships with their patients.
It's a challenge, but an important one. We can't let technology eclipse the human side of healthcare. So how can doctors ensure they're building trust and rapport with patients, even when those interactions are happening through a screen?
It starts with using video conferencing whenever possible, seeing each other's faces. Those smiles, nods, and expressions of concern makes a huge difference in building a connection.
It's those nonverbal cues that add a layer of human connection that's often missing in emails or phone calls.
Exactly. And think about your virtual space. Just like we talked about, setting up a professional environment for hearings, the same principles apply to patient consultations.
It's good lighting, a neutral background, minimizing distractions. It's about creating a virtual space that feels welcoming and puts the patient at ease.
That's right. And just as important as being fully present during the interaction, put your phone away, close any unnecessary tabs on your computer, and focus on your patient.
It's like giving them your undivided attention even though you're not physically in the same room.
Yeah.
It's amazing how much those small gestures can convey.
Absolutely. And when you're explaining things, use clear, patient-friendly language, ditch the medical jargon, and make sure the patient understands what you're saying.
It's about meeting them where they are and guiding them through the process. What about after the virtual consultation? Are there any tips for ensuring patients feel supported and informed?
Summarizing key points at the end of the consultation is helpful. Make sure the patient understands the next steps in their treatment plan, and don't underestimate the power of a simple follow-up. A quick email or phone call to check on their progress can make a world of difference.
It shows you care and that you're invested in their well-being even beyond the virtual visit.
Exactly. And as technology continues to evolve, I encourage doctors to stay open to new ways of connecting with patients and providing care.
Things like telemedicine, remote monitoring devices, virtual support groups. There are so many exciting innovations that can enhance the doctor-patient relationship. It's all about harnessing the power of technology to improve patient care and make the system more accessible.
Well said. It's a time of incredible opportunity in healthcare. And while virtual technology presents challenges, it also offers a chance to reimagine how we deliver care and support our patients.
This has been such an insightful conversation. Thank you so much for sharing your expertise with us today.
It's been my pleasure.
And to our listeners, I hope this deep dive has equipped you with the knowledge and confidence to navigate the world of virtual workers' comp hearings. Remember, stay informed, stay curious, and stay engaged. By embracing change and focusing on the human element, you can not only adapt to this new landscape, but thrive in it. Thanks for joining us
listening
on
to Workers
Unwrapped.
Comp
We'll see you next time.
Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.